Okay, part 3. So a nasal pack, when we're talking about a nosebleed, they're actually little bitty pieces of cotton. It does resemble feminine hygiene products, but smaller to go in there. If you are really, really prone to nosebleeds, sometimes the doctor will suggest cauterizing the bleeding vessel, which where they'll go in and they'll actually burn the vessels on the inside of your nose to kind of keep them from bleeding again. And then you always want to try to eliminate the underlying cause. Treatment for nosebleeds used to be, and sometimes you still see it depicted this way on movies, but you get a nosebleed, everybody tilts their head back. That is not correct. You've got to make sure that you tilt your head slightly forward. And the reason we do not tilt our head back is you do not want the blood to go down your esophagus. Nobody wants to swallow blood. It's nasty. Also on nosebleeds, a lot of times if the weather is extremely dry and you have really high sensitivities to that, it can cause you to have the nosebleeds too because there's not enough moisture in the air to help with your mucous membranes. All right, influenza is the flu. It is a contagious viral infection of the upper respiratory system, and it happens very suddenly. Symptoms are chills, fever, cough, sore throat, runny nose, muscle pain, and fatigue. Treatment, bed rest, fluids, pain medications for fever and for pain. So your Tylenol, your ibuprofen, things like that. Antibiotics, they're not effective against the virus, but they are given to avoid a secondary infection like pneumonia. Laryngitis is the inflammation of the larynx and the vocal cords. It may occur with respiratory infections. You guys all know what it's like to lose your voice. Symptoms are hoarseness, loss of voice, sore throat, dysphagia, which is difficulty talking, and then difficulty in swallowing. Treatment are rest, fluids, limited use of the voice, medications if there is an infection present. Pleurisy is inflammation of the pleura. It's remember the pleura is the membranes of the lungs, so it's that lining, that sac. It occurs with pneumonia or other infections. And if you think back to your medical terminology, whenever we were talking about inflammation is usually always referred to as itis. This is honestly the one disease that I can think of that is actually pretty common, that instead of it being pleuritis, is pleurisy. So you guys need to make sure that you pay close attention to that it's not pleuritis, it is pleurisy. Symptoms are a sharp stabbing pain while breathing, crepitation, which is a grating sound in the lungs. It almost sounds like if any of you guys eat Rice Krispie cereal, so Snap, Crackle, and Pop, whenever you pour milk into the cereal and it kind of makes that popping sound, that's what crepitation sounds like inside the lungs. You've got dyspnea again, and then fever. Your treatment are rest, medications to relieve the pain and the inflammation. Fluid, if it collects inside the pleural space, there has to be something done called a thoracentesis. And what a thoracentesis does, it withdraws fluid from the sac around the lungs with a needle. Sometimes people have thoracentesis done with if they're a cancer patient, if they have congestive heart failure, things like that. And it's a very large needle that you have to insert in between. Usually it's the 5th and 6th rib. And then based off of the location of the fluid, it sometimes can be between the 7th and the 8th intercostal space. And sometimes they don't even draw it off with a needle. It's like, or a syringe. It actually is hooked to a drainage system, and they leave you hooked up to it overnight and try to pull off all that extra fluids. And sometimes the amount of fluids that you get from some of these patients are 2 liters, 3 liters, 4 liters. It's insane. Pneumonia is Inflammation. It's an infection of the lungs. It's a buildup of exudate, in the alveoli. It's caused by a bacteria, virus, or it can be triggered from chemicals. Symptoms are chills, fever, chest pain, a productive cough, dyspnea, and fatigue. Treatments are bed rest, fluids, antibiotics if indicated, respiratory therapy, and pain medication. Rhinitis is inflammation of the nasal mucous membrane. It's a runny nose, it's sore, and it's congestion. Common causes are infections and allergens. Treatment, fluids, and medications to relieve the congestion. Sinusitis is inflammation of the mucous membranes lining sinuses. It's caused by a bacteria or virus. Symptoms are headache, pressure, thick nasal discharge, congestion, and loss of resonance in the voice. Treatments are pain medications, medications to loosen the secretions, moist inhalations, so the nose sprays. If you have chronic sinusitis, they may suggest surgery, which will open the cavities and encourage drainage. Now, one thing you need to know about sinus infections and sinusitis is that sometimes whenever your sinuses get very blocked up, you start having pain underneath your eyes and around your eyes. That is called an ocular sinus infection, and that's where those sinuses that drain up around the ocular cavity will actually become congested and inflamed and thickened, and it causes a lot of pain. Sometimes you have a maxillar sinus infection where the sinuses drain down into the upper jaw. And sometimes the sinus infections can get so bad that if it's not treated with a maxillary sinus infection, you actually can taste the pus. And sometimes you actually have the pus and sinus drainage from those cavities coming out through your teeth around your gums. And it's very, very painful. All right, TB is tuberculosis. It's an infection disease of the lung. It's caused by bacteria, Mycobacterium tuberculosis. That is a picture of what tuberculosis does to the inside of your lungs. It pretty much turns your lungs to mush. WBC is white blood cells. They may surround the invading TB organisms. They will wall off, creating a nodule called a tubercle, which almost looks like, if you've seen the bottom of boats, the little round barnacles, but softer is what it ends up forming in there. Organisms will remain dormant in the tubercle and can cause an active case of TB later if the body resistance is low. So you could have it and then not have any kind of symptoms or any kind of flare up until, let's say, 10 years down the road, you get pneumonia and suddenly your body resistance is low and suddenly this kind of stuff acts up. Symptoms of active TB: fatigue, chest pain, fever, night sweats, weight loss, hemostasis, which is where you cough up a blood-tinged sputum, so blood-tinged spit. Treatment, administration of drugs to destroy the bacteria, good nutrition, and rest. A URI is an upper respiratory infection. It's the common cold. It's inflammation of mucous membranes lining the upper respiratory tract. It's caused by viruses, and it is highly contagious. Your signs and symptoms are fever, runny nose, watery eyes, congestion, sore throat, a hacking cough. There's no cure, but you can do minimal treatment. Symptoms last about 1 week. You use medications for pain and fever. Get lots of rest. Increase your fluids. Take antihistamines to relieve your congestions. Tomorrow I will assign your memory page, and I will have your lung labeling page ready for you guys to do. Make sure you took your notes. Thank you.